Hello, and welcome to the OSHA Bloodborne Pathogen Training. My name is Brooke Anderson, and I am a nurse who works as a consultant for the White Rhino Company. Every year, OSHA, the Occupational Safety and Health Administration, and the law require all workers who may be exposed to blood at work receive training on how to prevent getting an infection from the blood or other potentially infectious materials they may come into contact with at work. This training meets all of the requirements in the law and has some additional information that the White Rhino Company feels is important to keep you safe. The objectives today are to define what a bloodborne pathogen is, to identify what puts workers at risk. We're going to explain the White Rhino Company Exposure Control Plan and let you know where you can locate it. We're going to describe how to decrease your risk of being exposed to blood or other potentially infectious materials at work. We're going to explain which steps to take if you are exposed. And we're going to review the Hazardous Communications Program. So just a little bit of background. It is estimated that 5.6 million workers are at risk of being exposed to bloodborne pathogens at work. Exposure to blood or other potentially infectious materials, OPIM, places workers at risk for infection. Workers in many occupations, including all of you in housekeeping, may place you at risk for exposure. Employers are therefore responsible for training staff and helping to protect workers from exposure risks. So what are bloodborne pathogens? Bloodborne pathogens are microorganisms in human blood that can cause disease. Some examples that are of main concern are hepatitis B, hepatitis C, and the human immunodeficiency virus, or HIV. There are many others out there, but they are not as common in the United States, so we will not be discussing them today. Hepatitis B. More than 1.2 million Americans are infected. The majority of them never even know it, because it can take up to 30 years to develop symptoms. If there are symptoms, they may include things like yellow skin, feeling tired, having stomach pain, not feeling hungry, being sick to your stomach, and throwing up. In 15 to 25% of cases, it can lead to chronic liver disease, liver cancer, and potentially even death. Hepatitis B can survive for at least 1 week in dried blood. And hepatitis B is up to 100 times more infectious than HIV. So if you get exposed, you have a higher likelihood of actually getting it from the blood. Hepatitis C is very, very similar in symptoms and everything to hepatitis B. It is the most common chronic bloodborne infection in the United States. Many people have no symptoms until later in life, when the liver has already been damaged. If there are symptoms, they're very similar to hepatitis B, and it can include things like yellow skin, feeling tired, stomach pain, not feeling hungry, being sick to your stomach, and throwing up. Just like hepatitis B, it can lead to chronic liver disease and death, and this one can live for up to 3 weeks in dried blood. Human immunodeficiency virus, or HIV. 1.2 million people in the United States are living with HIV. HIV is the virus that then can lead to AIDS. Just like in the hepatitis B and C, many people do not know that they have it. HIV affects the body's immune system, which is typically what protects you from diseases. Therefore, by attacking the immune system, it makes you more likely to get sick. If you do have symptoms, it may be things like fever, night sweats, feeling tired, or having achy muscles and body. HIV can only survive a couple of hours outside of the body. So why do we teach you all of this every year? So there's a law called the Bloodborne Pathogen Standard. It has been in effect since June 4th, 1992. It is located in Title 29 of the Code of Federal Regulations. Basically what it does is protect workers who could be exposed to blood or body fluids at work. It states that blood and body fluids must be treated like they could cause an infection, and it requires employers to protect workers and reduce their risk of exposure. So what are you exposed to that could put you at risk? So number one, blood. But then the other big thing is other potentially infectious materials. OPIM is what you've heard me call it so far. This is things like human body fluids, like urine or saliva, human tissues or organs, like skin or eyeballs, or if they've taken a sample of somebody, cultures, culture mediums, or other solutions. So oftentimes if they're trying to tell if somebody has an infection, they might take a blood or a sample and put it in something else to try and see if anything grows. That's a culture. And then experimental animal blood, tissues, or organs that were intentionally infected with HIV or hepatitis B, which is usually used in experimental type things. So the spread of bloodborne pathogens can occur through several means. The first is through direct contact, where one person touches another person and passes the pathogen. It can also happen through indirect contact, which is where one person touches an object and then another person touches the same object. For example, a doorknob. Respiratory transmission is where it can be passed through the air, or vector-borne transmission, which are things that can be carried through like a mosquito or a tick, where it bites one person and then it bites a second person and passes the virus from one person to the other. So White Rhino Company has created an exposure control plan, which identifies which jobs and tasks are at risk. In addition, it describes how the White Rhino Company will make things safer for workers, provide personal protective equipment, also called PPE, train workers, provide access to medical care if you are exposed to blood or OPIM at work, and how to get more information on getting the hepatitis B vaccination series. It can be found in the White Rhino Company main office. So engineering and work practice controls are ways to modify the environment or the way that you do things to make it safer. So for example, safer medical devices. Most organizations now use what are called retractable needles, which are needles that disappear into the holder to reduce your risk of getting stuck by the needle and therefore passing an infection from the blood onto yourself. Sharps disposal containers to help prevent additional sharps injuries. 1/3 of sharps injuries actually occur during the disposal process. And then hand hygiene. So making sure you're washing your hands when you can see any visible dirt on them. Using hand sanitizer regularly. This is the most important way to prevent infection. Another way to prevent exposure is wearing personal protective equipment, PPE. This is things like gloves, masks, aprons, smocks, gowns, face shields, and safety glasses, depending upon the type of work that you're doing and what your exposure risk is. There are several employer responsibilities when it comes to controlling exposures. Number one, performing an assessment to find risks. Number two, providing the needed PPE, that personal protective equipment, to employees at no cost. Number three, training employees on the use and care of PPE. Number four, maintaining and replacing PPE. Number five, reviewing, updating, and evaluating the PPE program. But there are also several employee responsibilities. The things that you are responsible for are, number one, properly wearing your PPE. For example, if you wear a mask and you don't have it covering your nose, it is not going to protect you, and therefore you're putting yourself at risk. Number two, attending trainings like you are today. Number three, caring for, cleaning, and maintaining your PPE. Number four, notifying your supervisor when your PPE either needs to be repaired or replaced. Note the majority of PPE is disposable, like your gloves and masks. However, there are some things like goggles that may be reusable or rewashable. And then five, it's really important to make sure you're following all policies, not only of the contracted site, but also of the White Rhino Company. Other ways to control exposure are to make sure that you're following housekeeping rules. So following the written schedule for cleaning and decontaminating. So for example, if a location is supposed to be cleaned Monday, Wednesday, Friday, You want to make sure you're cleaning it Monday, Wednesday, and Friday according to schedule. If there is broken glass on the floor, do not pick it up with your hands. Instead, you want to use mechanical means like using a dust brush and dustpan so that you don't accidentally cut yourself. And one of the most important things is absolutely no food or drink in dirty soiled areas. So if there is any sort of dirty linen or other dirty materials in a location, you should not even be drinking a bottle of water. You want to go into a clean area, make sure your hands are clean before you consume any food or beverages. What is regulated waste? So regulated waste are items that have blood or other potentially infectious materials on them or in them. White Rhino Company rules state that regulated waste, the contracted site must put regulated waste in containers that are closable, constructed to contain all contents and prevent leakage, labeled or color-coded, and closed prior to prevent spilling. If you see a container is leaking or the contents are not within the container, notify your supervisor. You are not responsible for cleaning up spills of blood or OPIM, only for disinfecting after nursing staff have removed all visible body fluids. What is a sharp? A sharp is a medical item which has sharp points or cutting edges that can cause injury or break through the skin. These are things like needles or scalpels or scissors. If you find a sharp or are not sure if there is a sharp, do not touch and immediately tell the nursing staff. On the left side here, it's hard to tell what happened, but it looks like there was some sort of a medical emergency and the staff kind of threw all of the garbage in the corner. There is a syringe there, but that syringe does not have anything attached to it, which means that there is not a needle. But if you aren't sure, you would still want to contact the nursing staff to come look through it. On the right-hand side, though, that little pink device that you see, that is a retractable needle, and that is something that you would not want to touch. You would want to make sure that the nursing staff came and disposed of it. Because although it is a retractable needle and it shouldn't cause damage, sometimes they don't work correctly, and so it's still important to get the nursing staff. Contaminated laundry. You want to make sure that it's bagged or put in a container at the location where it was used. It should be handled as little as possible. It should be placed in color-coded or labeled bags and containers. You want to make sure you're using that personal protective equipment like a gown and gloves when you're touching it. All wet laundry should be in leak-proof containers. Cell phones. Believe it or not, cell phones are one of the most touched items and therefore are dirtier than a toilet. Ways to prevent infections being passed on your cell phone are using a waterproof cover to make cleaning and disinfecting easier, making sure you wash or sanitize your hands before touching your phone, making sure you don't use your phone in the bathroom, and then making sure you clean your phone at a minimum the beginning and end of your shift. That way you're not bringing anything from home into work or anything from work into home. But keep in mind, if you're taking your phone out in various places throughout the hospital, you are passing bacteria and viruses and other things from location to location. So how do you clean a cell phone? Before you start, you want to turn off your phone and wash and sanitize your hands. You want to review the requirements for your brand cell phone, but if you don't know, most phones you can use the 70% isopropyl alcohol or Clorox disinfecting wipes. If you're using isopropyl alcohol or a liquid cleaner, you want to put the disinfectant on a lint-free cloth or a cotton ball, but you never want to apply a liquid directly to your phone. Gently wipe the front and back of the phone, making sure you're covering all surfaces. And it's important to never use bleach, as that will damage your phone. Dress code. Clothing is another layer of protection which can reduce exposure to bare skin. The White Rhino Company requirements are to wear a closed-toed shoe with a back, long pants without holes, your White Rhino Company issued uniform. If you do not have a uniform, a white polo shirt is acceptable. If you are working in a building that is closed and there are no employees present, a white polo is still preferred. And absolutely no shirts that expose the chest or the abdomen. The hepatitis B vaccination is offered to all workers who are at risk. This includes all of you at White Rhino Company. It is provided at no cost. If you choose not to get the hepatitis B vaccinations, you must sign a form saying you're not interested. And if in the future you change your mind and you do decide that you want the vaccine, you can get it at any time. Unfortunately, there are no vaccinations for hepatitis C or HIV. So what is an exposure incident? An exposure incident is when you are at work and have contact with blood or open, and then either your eye, mouth, other mucous membrane like your nose, or if you happen to have non-intact skin. So if you had a cut on your skin and blood or open got in it, that would be considered an exposure incident. When exposure occurs, the very first things that you want to do are wash it with soap and water. If it happens to be your nose, mouth, or skin, flush it really, really, really well with large amounts of water. If it's your eyes, you're going to irrigate it with water or saline, and then immediately notify your supervisor. Just want to point out that there is no evidence that squeezing the wound or putting an antiseptic on it will decrease the risk of getting a bloodborne pathogen, so that is not recommended. Once you have done the initial cleaning and notification of your supervisor, you're going to report to urgent care if it's before 9 p.m. or urgent care is still open, or the emergency department if it's after 9 p.m. or urgent care is closed. You're going to notify the medical staff that are treating you that this is a work-related injury or exposure. Once you are done being treated, you're going to request a copy of the medical report be sent to the White Rhino office fax. And then you're going to complete the incident report with your supervisor and turn it into the leadership team. That way we can kind of take a look at what happened and put practices into place to make sure it doesn't happen again in the future. When you go to urgent care or the emergency department, some of the things that they may do during the medical exam include drawing blood to check for hepatitis B or AIDS or HIV. This is just to make sure that they have a baseline to make sure you didn't get contaminated from something before. It would be too soon to tell if that particular exposure that you were being seen for gave you the virus, but it would let you know that you didn't have it before that time. They could also potentially give you a tetanus vaccine if they determine that you have any break in the skin and it's been more than 5 years since your last tetanus shot. And then they can do any other assessment or treatment advised by the medical provider. So if you have a cut or a wound, you might need stitches or treatment for that. White Rhino Company will provide follow-up as needed. So if you need to go back to the doctor or you need more labs drawn again in the future, the White Rhino Company will help with covering the cost of that and making sure you get the treatment that you need. So it is important to know that signs and labels are required for all materials out there. So all staff, regardless of whether you're the contracted company or working for White Rhino, are responsible for making sure items with blood or open are labeled with a biohazard label or placed in a red bag. If you do not find a proper label on something, let your supervisor know. What is the Hazardous Communications Program? So the purpose of it is so that hazardous substances at work are identified and labeled, so that workers have access to information on the hazards of these substances, so that workers are provided information on how to prevent injury or illness due to exposure to these substances, and to identify who is responsible for maintaining the program. A copy of this program is located at the White Rhino Company main office, but it is also located within the White Rhino Company safety binder in the housekeeping closet. So basically every chemical that you could be exposed to at the work site will have a sheet in the safety binder with additional information on it. The information on it is called a safety data sheet. Back in the day, prior to 2012, it was referred to as material safety data sheet, but they standardized them across countries so that the pictures and the information contained in them are the same regardless of what country you happen to travel to. The safety data sheet includes information such as properties of the chemical, physical, health, and environmental health hazards, ways to protect yourself from it, and then safety precautions for handling, storing, and transporting the chemical. This is a sample of a safety data sheet. So one of the most important things is making sure the name of the sheet that you were looking at matches the name of the container. Section 2 has information about possible hazards associated with that particular chemical. Number 4 has possible symptoms if you get exposed, and then first aid steps to take should you be exposed. Number 7 explains storage and handling. Section 8 will tell you if you need to use any personal protective equipment like gloves or a mask when you're using the chemical. And then number 13 will tell you how to dispose of the chemical. So if for some reason you as the housekeeper are being asked to get rid of something, it'll tell you whether or not you're allowed to put it down the drain or not. So the safety data sheets use pictograms, these nice little pictures, to indicate the hazards of a chemical. And that's what I was talking about when I said that those pictures are the same across, regardless which country you are in. Thank you very much for completing the OSHA bloodborne pathogens training today. If you have any questions about this content, please let your supervisor know. I look forward to seeing you again next year.